Hey guys, thanks for joining us here at Salty Ginger Talk. If you're a returning listener, it's great to have you back. If you're new to the channel, really glad you joined us. Hope you like what you hear. If this is your first episode, we have such an awesome guest on. Look, we've always find awesome guests. We find awesome people from all over the world. And today's no exception. Our guest today is Dr. Ron Anbar. He has a practice out in California. He also has a practice in upstate New York, which is where he originated, and he'll walk you through his whole story. But he is a board certified pediatric pulmonologist and hypnosis therapist. And so his practice works with people to use their subconscious mind to improve physical outcomes for, we're not talking about just anxiety or depression. Those things can be treated as well. We're talking about things like irritable bowel syndrome, headaches, physical problems in your body that he's had a ton of success treating through hypnosis training of your subconscious. So we're going to talk about all that stuff. He's just he's got a positive outlook on life. He's super interesting when he talks through these subjects, and his life story is also very interesting because he was born in Israel and then immigrated to the United States and has done all sorts of cool stuff. So without further ado, let's bring Dr. Anbar on now. So Dr. Anbar, thank you so much for joining us here at Salty Ginger Talk. I've really been looking forward to having you on the program.
Thank you so much for inviting me.
Yeah. So we're going to take a little different approach with you. Well, let me not say that. I'm very willing to take a little different approach with you. I think our podcast is we really just encourage people to live a meaningful, purposeful life. Now, they have to decide what is important to them and what they pursue, but what we advocate for is don't float. Don't let the tide of life push you around. You should pick the direction that you go and what you want to go after. And we're agnostic to what that is, so long as it's, not a criminal enterprise or destroying humankind. But so what we usually do is we'll have people come on that have built a really great life for themselves and how they got there. And so what they do is talk about their history and the things they learned, typically from all the things that went wrong, as you know, from your line of work and your own life experience. Most of us learn much more from getting burned by the stove than we do the sweet dessert that we eat, right? And so what we typically do is have our guest talk about their history and then go back and talk about their inflection points. You're a unique guest in that you have very narrowed. I don't even know if that's the right way to say it. Let me say it this way: the combination of what you bring to the table is very unique. Narrow is not the right way to say it at all, because it's actually very broad. But the combination that you bring to the table to engage in these conversations, give advice, and help people is very unique. And I'm very interested in exploring that. So if you want, it would be great if you could give folks a brief background of how you got from being a young boy to being the Dr. Anbar that sits in front of us today. And then we can talk at length about all of the subjects that you spend so much time working with other people on. Does that work for you?
Sounds good to me.
All right, let's do it. Tell us about how you got from where you were to where you are, and then we'll dive in.
So I was born in Israel, and one of my earliest memories is walking in Tel Aviv with my mother, and some man had trapped some wild birds, and I didn't think that was right. He was selling them, and so I asked for my allowance, and I bought 2 of them and let them go. That's the way it was supposed to be. I also was, as a bright kid, I got the chance to skip first grade, which was helpful. In those days, you're allowed to skip grades. So I ended up being youngest in my class, which was a good thing because it was a little bit harder to keep up with older kids.
Mm-hmm.
When we moved to the United States when I was 9, I didn't know English. So that was another nice challenge, which was good because I work with bright kids now, and they often get really bored with the regular school curriculum, but I had these extra challenges. But by middle school, I was taking community college classes. I took one in astronomy. In those days, there was no internet, so but the public broadcasting station broadcast astronomy course. So I took notes, and took the test, and got an A, my first college class. And before I entered college at University of California, San Diego, I had enough credits to come in as a sophomore. And let's see, so many stories to tell. So I didn't know what I wanted to do for a career. I started off college as a psychology major because that seemed easy, intuitive, but it was too easy. So I thought I'd take a serious major. So I became a biology major, had biology major as well, not knowing what I wanted to do. I got involved in the school newspaper, the Triton Times, which was changed my senior year to the Guardian, because people wanted to be more advanced. I'm conservative, so I didn't like the change. But anyway, we went from a 3 times a week paper to a daily paper my senior year. That was really cool. I was news editor, and putting out a daily paper is really a nice enterprise. In those days, you didn't lay it out on a computer. We didn't even have personal computers, so you actually typed it on a typesetter, and then you paste up the newspaper. And I have a cut on my thumb here where I sliced the exact. Yep. And those are the days. That's the most fun part of college is the newspaper, not the classes. Got involved with the Union of Jewish Students in my senior year of college, and ran a Passover Seder where I invited the Jewish kids on campus plus anybody else who wanted to exchange their meal plan for a Seder experience. And by the time we got done, there were 350 people there, which is really cool. For a moment, I thought maybe I should become a rabbi, but that passed in a few moments. I'm telling you this story because I was involved in biology and psychology and Judaism and journalism, and I had no clue that 20 years later I'd combine everything into one career. I didn't know it existed. I had a lot of fun in college. By the time my junior year rolled around, I still didn't know what I wanted to do for a career, and I was going to go maybe for 5 years, pick up an economics major as well. And I was going to be editor-in-chief of the newspaper was my plan in the senior year, but I lost the election by 1 vote.
Oh,
because I know I got mad at the cartoonist about something or other, and then he voted against me. So it's March of my junior year, and I'm saying, oh, what I'm going to do, I didn't really want to do the economics all 5th year. I'm not going to be editor-in-chief. So I called a friend and said, what do you think I should do when I finish college? He says, what about medicine? I said, medicine, yuck. Blood and gore and pre-meds are really not nice people. And if you've gone to college and you med some pre-meds, on average, you tend to be very intense. And my friend said, well, you could get used to blood and gore. And I thought back to my experience with squirrel monkeys back after my freshman year in college. I was in a research lab. We were studying whether microwave radiation affects pregnant squirrel monkeys. Those are days the microwave just came to the kitchen, so they wanted to make sure that it wasn't going to hurt babies. And squirrel monkeys are cute creatures, but they smell terrible. And when I first started working at it, was awful, but in the summer I couldn't smell them. Why? I was desensitized, and I realized that I could do that with blood and gore as well. So I decided to go to medical school, and it was like that, one phone call. And I've since learned about myself. I make life-changing decisions on a very whim, not a whim, but very quickly.
Yep.
And I've always been pleased with my decisions because I'm the kind of person, whatever I'm at, I can make the best of it. That's what I've learned about myself. So I went to sign up for the medical college admission test, MCATs. That was being given 3 weeks later. And the lady who signed me up, she's saying, people have been studying for 3 years for this test. I'm signing up 3 weeks beforehand. And she says, what are you doing? I said, I've decided medicine is just the thing for me. And she said, medicine's not just a thing for anyone. And she said later, she thought I was very arrogant. I just decided it was the right thing. So took the MCATs. I studied for a whole week during spring break. The day I tell this story to my patients who are perfectionistic and want to get everything right, I said, what do you think I did the day before the MCATs? They'll say, stay up all night studying. I said, no, I went to the San Diego Padres baseball game. And I figured either I know enough to pass the test or I'll do well or I don't. And if I don't, I'll do something else. And that's something I teach in my counseling practice. I teach kids that as long as you work hard and you can make yourself, there's many paths to work for you. So I week later interviewed with a pre-med committee at UCSD. They write a letter of recommendation for you. I remember the chairman of the committee said to me, he was my chemistry teacher formerly, he said, my father is a physician and he hates medicine. Why do you think you will like medicine? And I said, should have said, my father's a chemist and he hates chemistry. My father was a chemist, but I didn't say that. I don't remember what I said, but I didn't have a well-formulated answer. So then I applied to medical schools. I applied to the top 8 schools in the country, from Harvard to University of Chicago, Stanford, and 4 safety schools, including UCSD. And I got interviewed in 7 schools right away, all the Ivies except for Harvard, but none of my safety schools, which I thought was rather odd.
Yeah.
And at UCSD, I found out that that the other classmates who were clearly poorer students than me were being interviewed. So I finally marched into the admissions office, the medical school. And, why aren't you interviewing me? They pulled my chart and they said, oh, it's because you didn't take any science classes as a freshman. And I said, I didn't take any classes as a freshman. I came in with sophomore standing. Oh, okay, we'll interview you. I'm thinking maybe the safety schools all did the same mistake. Who knows?
Yeah.
So I was interviewed and I wasn't getting in. In those days, medical school was a bit easier to get into than now. And by the time I came to I was waitlisted in a few schools. By the time I came to my last interview at Stanford, I asked my interviewer, is there any reason I haven't been accepted to medical school yet? And I think it was a medical student interviewing me. And she said, well, I can't tell you exactly what the letter of recommendation written by the pre-med committee said, but it said, you're a great guy, but they're not sure about your commitment to medicine. So, well, I had an interview 3 weeks after I decided to go to medical school. Please listen to me now. So I ended up being waitlisted in 4 schools, and I wasn't accepted until July 31st, a month before school started, at the University of Chicago, which is the top 5 school. And okay, I'll go. And then a week later, Stanford takes me off their waiting list. And I said, nah, too late. I'm going to Chicago. And my family had moved from Palo Alto to Buffalo. So I was close to home, and off I went. And I got to medical school, first class, anatomy class. And I'm looking around and I'm saying, oh my gosh, all of these are post-pre-meds. It's just as stuck up as before. But I found my crowd. There's a few of us are nice people out there. And then let's see, I had to decide a career within medicine. I always liked kids. I volunteered with the Children's Hospital of Stanford. I worked in nursery schools as a high school student, but I didn't want to make a choice based on my feeling. I wanted to make an intellectual choice, which, by the way, I would tell my people I counsel now is you need to go with your feelings and your intellect.
Yep.
Not one or the other, if you want to make a good choice. But it ended up picking pediatrics. I thought about surgery. Surgery seemed fun because there's a problem, you cut it out. And it's gone.
Right.
I didn't want to do internal medicine. I didn't want to work with adults who are the cause of their illness. So, a smoker comes in with lung cancer, alcoholic comes in liver disease. I would feel differently now. I'm more understanding. But in those days, I said, if you're going to I'm going to treat you, and then you're going to go do the same thing that got you in the hospital. I don't want to treat you.
Right.
Feel right. It's like, I didn't want to defend, if I was a lawyer, which I thought about too, I didn't want to defend somebody I know is a criminal, even though he's supposed to. But I feel differently now as a physician. If you want to, we can talk about that, because I think some of your listeners probably have substance abuse problems. And I'm a lot more understanding and empathetic now than I was as an 18, or I guess a 20-year-old.
Yeah, and there's a difference between empathy and sympathy, right? And there's a difference between listening and trying to help and listening and enabling. And, I mean, you're a professional. I'm certainly preaching to the choir here and punching above my weight, but by dismissing it out of hand, probably not the right approach. But I think from my perspective, too many people enable behavior and won't have the appropriate conversations. And it's not always, direct, stern, hard conversations, but sometimes you have to tell people the uncomfortable truth, or get them, better yet, get them to see the uncomfortable truth themselves. And that's the hard part.
Correct. I mean, today I would tell you, if somebody who has a substance abuse problem is trying to cope the best they can, it's it's not a good way of coping because it leads to down its own bad paths. But I would be a lot more compassionate than I was as a flippant 20-year-old, or I guess I was 22-year-old. You learn stuff. So I decided pediatrics. I did my pediatric residency at Mass General Hospital, which was a smaller program, which I liked. And then I had to decide if I wanted to specialize. I didn't know what I wanted to do. Again, you'll see a certain pattern in my story. So I decided I wanted to be the chief resident, which is an extra year where you supervise other residents. I wasn't picked for it. And my department chairman came in, called me in and said, don't tell anyone I said this, but just get on with life. You don't want to be chief resident. I've told this story many times. He's passed. So here we go. So I thought about pulmonology because when I was volunteering at Children's Hospital of Stanford, I met kids with cystic fibrosis, which is a genetic disease that causes bad lung disease typically. And I had a friend in high school who died from CF. In those days, people living to their late teens. It's a terrible disease.
I went to high school with someone that had and passed away from cystic fibrosis, so I actually know exactly what you're talking about. He was in my class until he passed away our junior year.
That's happened with my high school friend. Which high school did you go to?
Yeah, I'm from Portland, Oregon, but yeah, it was Centennial.
Okay.
Yeah.
I was in Palo Alto, California. But the CF is the most common common terminal disease, genetic disease affecting Caucasians. It happens 1 in 3,000, so it's really frequent. 1 in 20 people are carriers of this gene. We can talk about why it's so prevalent. But anyway, so I decided to go to pulmonology because I wanted to find a cure for CF. Big dream. So I went, it's a 3-year fellowship, did some research, finished at Harvard, then decided to go to the best pulmonary program on the East Coast, which was in Philadelphia at the time, Children's of Philadelphia. Mistake, because I went with intellect, not the heart. And they wanted me to do research. And when I wanted to see patients, they said, no, you can't see patients, you're here to do research. That's when I figured out I like to work with people, or I like to work with people more than work with test tubes. And so I left after a year. And I think it's okay if you make a wrong choice. So you talked about being burned, and you learn from it. Not only is it not the end of the world, you learn. You learn what you like, what you don't like. I moved across town to Hahnemann University Hospital, which has since closed. I turned to a hotel, I think. It was an old medical school. Worked there 4 years, and then it's down over to the Senate. It was bought up by another institution. They ransacked the retirement funds for the faculty, and one day they announced they're closing the Department of Pediatrics without any plan for the medical students. So when it was pointed out, the medical students had nowhere to go. They said, "Oh, it'll open again." And I said, "I'm getting out of here."
Yeah, no kidding.
And so then I moved to Syracuse, New York, where I became the division chief for pediatric pulmonology and the Cystic Fibrosis Center. I was there 21 years. I got the chance to grow the division from staff of 5 to a staff of 25, and from having 2 half-day clinics a week to 11 half-day clinics a week among the department. We were the biggest division in pediatrics in Syracuse. And then 5 years after getting to Syracuse, this is when I encountered hypnosis. So hypnosis, this is how I encountered it. One of my patients with severe food allergies and asthma told me when he smells cheeseburgers, he develops asthma attacks. Kind of strange. So I said, can you imagine eating a cheeseburger? And he developed an asthma attack. I said, stop it. And he did. I said, you're kidding me. No, I couldn't breathe. That was my asthma. I knew enough about hypnosis, which wasn't very much. One of my colleagues had taken 100 hours of hypnosis training, but she was too scared to use it. She was a nervous Nelly. That wasn't her name.
Her name wasn't Nervous or Nelly, neither one?
Well, she was nervous. So when I started playing with hypnosis, it kept saying, you're playing with fire, playing with fire. I was looking for the fire and I couldn't find any. And it turned out, I think the fire is if you as a clinician are worried about what's going to happen or something bad will happen, you can bring it on. really believe that. Because thankfully, I've never seen what I would call fire with hypnosis. So I wondered if this asthma attack was hypnotic. So I told him to hold up your hand and imagine me feeling. Imagine feeling. Oh, let me know if you can feel me touching you. No, getting this wrong. Imagine a glass plate on your hand and tell me if you feel me touching you. Nope, can't feel you touching. So I took out my pocket knife, pulled out the corkscrew. That pocket knife was later confiscated by the airlines. I jabbed her. Ouch! No, I apologize. I jabbed him. I can't feel that. Then I jabbed the other hand. Ouch! I said, this must be hypnosis. I don't know if it's you or me, but it's worth finding out about. That was my dramatic introduction to hypnosis. Remember, I was a psychology major in college, so
Yep.
I wanted to learn more about it. And I'm thinking, if you can think your way into illness, can you think your way out? So I told the patient, his name was Paul, why don't you go learn about hypnosis? I'll refer you to a local psychologist and come back and teach me what you learned. And then I found a psychologist and I said, Paul, go see him. He said, I don't want to see a psychologist. I'm not crazy. I want to work with you. And I said, that's very nice, but I don't know anything about it. I don't care. So I asked my friend, the chief of child psychiatry, if he could back me up if I could learn about hypnosis. If I get in trouble, he'd help me. He said he would. He also introduced me to Dr. Ellen Cook Jacobson, who was a former internist at a medical center who had done hypnosis many years. And I met with her at her house by the lake on 3 occasions with copious notes describing what I've done with my patients. She gave me a lot of feedback, taught me a lot of stuff. And I practiced with Paul. He was really good at it. Now, I mentioned hypnosis. All hypnosis is self-hypnosis. I tell my patients it means using your imagination to help yourself. When you see stage hypnosis for entertainment, and the magician is controlling the people, he has no control. They're just following his instructions, and they look like they're under his control. And if they don't understand what's going on, they may think they're under his control, because a lot of what you see in hypnosis is done by the subconscious, which means we're not aware that we're doing it.
Mm-hmm.
But I explain this to my patients. So if in your listening audience understand hypnosis is under your control, nobody could turn you evil or make you do things you wouldn't want to do. So I learned about it with Paul. He was really good at it. He learned he could turn off pain. He could go in the past to memories and rewrite them. He could go in the future, get future experiences, lots of cool stuff. Because I didn't know that even hypnosis societies, I didn't know what I wasn't supposed to do. So I got to do many new things that hadn't been done before, some which I've since written, now are used in the hypnosis world. You know, when you start a new field, if you know what you're supposed to do, you're not going to vary from it because you want it to work. So I still was in the Wild West of medicine. And then I found out there's hypnosis societies, and I took some courses. And I first took the intermediate course, then I took the advanced course, then I took the basic course. I was just curious what they teach basically. And later I became the president of the American Society of Clinical Hypnosis. And and then my wife got tired of living in the wonderful wintry weather in Syracuse, New York. And so 11 years ago, we picked up and moved to lovely La Jolla, California, which is the nicest place I ever lived. When I went to college here, like right now, it's in the mid-50s here, not too bad, in the middle of winter. So it's nice, blue skies. That's my story in a nutshell.
I love it. So interesting. I have a few questions about that, and then I want to kind of fast forward into more conversation around your practice and what you do in your practice now. But so you moved from Tel Aviv to the United States when you were 9 years old, and you did not speak English, right?
Correct.
What is your native tongue? Hebrew?
Hebrew, yeah.
Yeah. So, do you remember being concerned about that? Like when your parents said, "Hey, we're moving to the United States." Do you remember what your reaction was to it at 9?
Well, when we moved, it wasn't clear it was going to be permanent. We were going to go for a year sabbatical with my dad. My father was a chemist in Israel, and he had reached upper echelons of the Israeli scientific world. And if you wanted to go higher, you'd have to get into politics. This was like a big city, so in the United States, which she didn't want to do. So unbeknownst to me, once we were here for a year, my parents decided to be here longer. But when I first left, I remember talking to my fourth grade teacher, and she told me I'll be an ambassador for Israel in the United States. So that's how I felt when I came here. But I didn't know English. I knew math. And I remember in fifth grade, they gave us the math workbook for the year, the beginning of the year. And I worked diligently on it. 2 weeks later, I said, okay, what's next? It took them 3 more months to give me something else in math. But English was a nice challenge. Sitting in class, not quite sure what they were saying, but it's interesting. I was lucky I could pick up things quickly, so I learned the language. Actually, I have a funny story about that. So in ninth grade, so I'd been here 4 years at this point. My English teacher was a very disciplinary grammarian. I had no idea. Never studied grammar. I just learned by listening. And he decided to recommend me in high school, 10th grade, to remedial English. There was 5 English languages: AP, honors, regular, remedial, and English as a second language. So I find myself in remedial English with a bunch of football jocks who could care less that they're there. Any American who's in remedial English doesn't pay attention.
Right.
I guess you could be mentally challenged, but these weren't mentally challenged kids. Kids who couldn't care less. I went up to my teacher, Robert. Oh my gosh. He was a really good teacher, but his name escapes me. First name was Robert. He was the chairman of the English department in my high school. And Heinemann, yeah. I was thinking Heinlein, but that was the science fiction author. And I came up to him and said, I don't think I belong in this class. He said, well, we'll see. A week later, he said, you're right, you don't belong here. We'll move you up to regular English. And I said, no, I'd rather stay with you, because he was a really excellent teacher. And he said, well, I'm going to give you extra work. I said, cool, bring it on. So I got to read the honors English curriculum, Dostoevsky and the Shakespeare, stuff like that, which is cool. And I got private tutoring, if you would, for the year. And that's the other thing I tell people: pick the teacher, not the subject.
Completely.
Classes, because a bad teacher can make the best subject awful, and a good teacher can make the worst subject amazing. So this is a story of, you run into people who don't quite understand you, and they put you down, but just get back up again. It's all right.
Yeah, that's right. And then I think I know the answer to this question, but I'd like to just hear you talk about it for a little bit. You, as a board certified medical doctor, making the decision to incorporate hypnosis into your repertoire and practice, that had to, and you weren't just I don't know the hierarchy in a medical institution, but you weren't just a staff doctor. You were running pretty significant pieces of the operation that you were a part of. What type of pushback did you get, and how did you handle that pushback? Because I can't imagine you all of a sudden said, hey, by the way, I'm just going to incorporate hypnosis into our practice. And everybody said, great. When do we start? I love it.
So, first of all, I think too many people like to work within their box.
That's right.
And I don't think we do our clients a favor, be it patients or law clients, whatever you're working with, students working within your box.
Yeah, that's not germane to the medical field. I totally agree. That's business in general. I totally agree.
Correct. It's everywhere. Yep. But working in a box is safe.
That's right.
Nobody's going to call you out for it. Nobody's going to give you grief. Nobody's going to sue you. But I believe that if you are doing the best for your client, sometimes you have to step out of the box, because sometimes that's where you find them. And the way you help people is go to where they are, not to make them come to where you are. As an example, as a cystic fibrosis center director, we had Amish patients traveling from Buffalo to Ogdensburg to Binghamton, if you know the New York area.
I do.
Big distance to come to Syracuse, because I was accepting of the Amish way of life. I mean, I wouldn't in a neighboring center, the Amish patients with CF were told, well, you can't do your herbs and stuff. You have to do what we tell you. And Amish says, no, we're not. And they left. And I would tell them, well, you can do your herbs. That's fine. If I think it's dangerous, I'll tell you. But maybe you could do some of the stuff I'm recommending. There's a good working relationship. So you got to go where you patient goes. You can't like practice in your box because sometimes you can't help people. So when I encountered Paul and he had life-threatening allergies and bad asthma attacks, and I saw that he could cause it with his imagination, I thought it was my obligation to figure out what's going on and help him with it. And too many doctors, maybe if we have time later, I'll tell you the sad story of how too many doctors refuse to step out of the zone of comfort, even if their patients are suffering, as a result of the doctor's discomfort with, with going a little bit outside the box. So when I decided to study hypnosis, so first, as I mentioned, I got a couple of people to back me up, Dr. Jacobson and Dr. David Keith, the child psych person. And then I remember talking to my friend at lunch. We'd meet with one of the doctors. I told him I'm going to be learning about hypnosis. He said, don't tell him you're doing that. They'll call you a voodoo doctor.
Mm.
And I said, I don't care. I mean, like in those days, for example, people don't want to tell parents that their kid has asthma. They tell them you have reactive airways disease. It's the same thing. Or chronic bronchitis. It's the same thing in kids. But I just call it asthma because call a spade because it adds confusion. I'm going to call it hypnosis. And I started doing, well, Paul was my one patient for a year. We'd meet on weekends. He was interested, so I'd read about it in the book and then do it, and he was really good at it. But later, as the practice expanded, I started with other kids with pulmonary problems, so kids with cough or shortness of breath or chest pain oftentimes improved a great deal by learning to calm themselves.
Mm.
Worked so well. I'm a pediatrician as well as a pulmonologist. I opened up my practice to anybody, and I work with kids with headaches, stomach aches, hair pulling, and bedwetting, and anxiety, and depression. It's all of pediatrics. As far as pushback, besides don't be a voodoo doctor, I didn't get too much pushback because it worked. You know, people understand how it worked, but the kids got better. So I just got referred a lot of patients. I started working on Sundays because I didn't want, I'm the full-time pulmonologist. They went, what are you doing? In fact, my new chairman came in 2000. I'd been doing hypnosis 2 or 3 years. He said, why is my pulmonologist doing hypnosis? And I said, because it helps pulmonary symptoms get better. And in time became a big supporter. He even sent me some of his nephrology patients.
Mm.
He had to write an editorial for Journal of Pediatrics, which is the major pediatric academic journal. He was on the editorial board about hypnosis. He became a very big supporter of what I was doing. So I didn't get that much pushback. I did get pushback from the Hypnosis Society. This is kind of funny and ironic. So I found out this Hypnosis Society, ASH, the one I was president of later on. And after I came there after maybe 2 years of doing hypnosis, and one of the faculty members told me, you should write up articles about what you've been doing. And I said, why? I've been doing this for 2 years. This hypnosis is a 70-year-old field. Why should I write about it now? What can I add? And it turns out I could add a lot because nobody had done a lot of hypnosis in the medical world. Most hypnosis work had been in the psychology world. Even that,
Yep.
It's a small minority of patients. So I started writing articles, and they were accepted in some major pediatric journals, which is cool. That's spreading the word. But change is slow, my friend. So change is so slow. Doctors are so conservative. I then started publishing papers in hypnosis journals. Because remember I told you I didn't know how you're not supposed to do things. So pretty quickly I had Paul type with me. We did typing in hypnosis, which had never been reported before, and I called it automatic word processing, and I still use that technique today. But other people around the world use it as well. And I remember that when I submitted that first paper, it took like 1.5 years for them to say yes, but whatever. I don't know the inside machinations. But then I wrote a paper about a follow-up paper for the Hypnosis Journal about using typing as a way of talking to the subconscious um, to cure flying phobia and vocal cord dysfunction. Vocal dysfunction is an entity where the vocal cords close when you try to breathe in, so you can't breathe. And it's usually stress induced, most often in athletes. Athletic stress, performance stress can cause it, but people also get it after child abuse and other forms of stress. And so I submitted the paper to the journal, and the editor had changed over, and I got the most vitriolic rejection letter ever. Now, if you're in academic medicine, submit papers to journals, getting rejected is no big deal. I've probably had half the papers I've wrote. I've published like 80 papers, and maybe 80 were rejected at some point. And then you can rewrite them and resubmit it. But usually they say, thank you for submitting. It's not appropriate for a journal, whatever. So this editor wrote me a letter saying, I have no business doing hypnosis with the subconscious. Oh, we should define subconscious. Subconscious is the part of your mind that you're not aware of, right? The conscious mind is the mind who's talking to me right now, and then subconscious, the part you're not aware of. But like when you drive a car and say, how did I get here? That's your subconscious mind driving the car. Or when you walk and you don't think about walking, that's your subconscious mind operating your feet. So it's there all the time. And the cool thing about talking to the subconscious is that it can tell you what's going on that the conscious mind may not know. So typically, if a patient has symptoms and we're not sure why they started, if they're psychologically driven, we can ask the subconscious and they'll just tell you. In fact, in my hypnosis book here, Changing Children's Lives with Hypnosis, I wrote about lots of examples of kids who sort of figured themselves out once the subconscious had its way to express itself. So I'm talking to the subconscious and learning about how what's making people tick. And as I did that, they could get over their phobias really easily. So this editor who's rejecting my paper says, you shouldn't talk to the subconscious, not a trained psychologist, as if psychologists do it. They don't. They do not talk to the subconscious the way I do. And any doctor, medical doctor, who doesn't practice psychology is not a good doctor. You've got to know psychology as a general physician, because how you talk to your patients involves psychology. But that didn't bother me so much. So she's, there's a lot in, some people are really territorial about their field. And then she said, vocal cord dysfunction is a very rare diagnosis. I have no business treating. And I usually would ignore a letter like that, but I had to respond. Dear editor, vocal cord dysfunction, I see patients with that twice a week. It's my bread and butter in pulmonology. It's far from a rare diagnosis. And absolutely, I'm the right person to treat it. So that was one pushback I got. And I've got some other pushback by psychologists. I had a medical colleague talk to me, not from my institution. He's really worried I'm going to get in trouble, and because I'm practicing out of my scope of practice. As an MD, you're allowed to work with humans. There was very little things you're not supposed to do as long as you think you're competent doing so. So, but the psychologists are trained otherwise, so that's okay. So that's the pushback I've gotten. But in general, my work has been accepted by the hypnosis community and by a lot of excellent psychologists, because the people who started psychology were not trained in psychology. There was no field of psychology, so it's not like you have to be trained to do a good job. I'm not recommending that other people not be trained. I think that if you recognize you have the ability and you have a track record, go for it.
It's one of my favorite quotes ever. Is that the first guy to walk on the moon had no experience, yet he still walked on the moon, right?
Nope.
Yeah, and I ask those questions, and I appreciate you talking through those things, because we have all sorts of different folks on the podcast to talk about their stories and the lives that they've built. And almost always it's been hard things or difficult things that have kind of been the crucible that made them the person they are now. And it pushed them towards the decisions that led them to get somewhere that makes them happy and makes them fulfilled. And even though they come from all different walks of life and they take all different approaches, They come from all different income levels. Gender doesn't matter. Age doesn't matter. Economic status doesn't matter. There's a couple of general truths that always pop up in our conversations. One of them is action. People that build a life take action. They don't equivocate. They make decisions. They get outcomes. They learn from those outcomes and they apply those lessons to their future endeavors and kind of continue to improve and learn and grow as people. So the best way to get over whatever it is that you're worried about is to deal with it. It's to go towards it, not away from it. And so action, action, action. We preach taking action. Our argument is a bad decision is almost always better than no decision because at least you learn something from the bad decision and you can apply those learnings and say, hey, that one didn't work the way I wanted it to. I'm going to try something different. But at least you're moving. And then the second one, which you've also talked about, which kind of drove a lot of your decisions, is you have to find a purpose for doing what you're doing that's bigger than just yourself. So you have to be intrinsically motivated, i.e., you've got to push yourself and take control and responsibility for your own life and your own decisions. But your driving reason for doing what you do isn't going to resonate with you and make you happy and fulfilled until it's focused on helping or growing something more than just you and your life. And so from your practice, it'd be very easy for someone in your position who has a board certified pulmonologist and or pediatric doctor to just stop there. But you said, hey, this hypnosis thing, I've come across this thing and I've seen something that I want to explore more. And you kept taking action and it was in the name of helping your clients. And I think I always try to call those things out for our audience. We always see those two things from people. They have taken action instead of sitting on their hands and crossing their fingers and hoping things went their way. They took actions to kind of make things go their way. And they focused on something bigger than themselves as they were working through that process. So I think I always try to call those two things out because they always come up when we talk to our guests. So love that. Really appreciate you sharing that with us. I'd love to if we go ahead.
And you don't wait for somebody else to do something for you, or don't blame the system. I can't do anything because the system won't let me. Then you get absolutely nowhere.
Yeah. We don't do victims. There's no victims on Salty Ginger Talk. There is, look, there's bad things that happen in life. Many times those bad things are out of your control. I totally understand that. And I totally acknowledge that. But my question is always, what are you doing about it? Because it's happened. You can't unring the bell, put the genie back in the bottle, put the toothpaste back in the tube, whatever analogy you want to use. This is now the reality we live in. And it's time for us to make decisions to move towards something that's going to help us grow and be better people. So we can't help a lot of those bad things that happen in our lives, but we certainly have control over how we react to them, how we approach them, what we learn from them, and how we use that information as we go forward. And I know from previous conversations with you, a lot of that is what you talk about in your practice. I just wanted to read a couple of lines from your website for our audience to give them kind of, in your words, what your practice is all about. So from Dr. Anbar's on Centerpoint Medicine on their website, to achieve optimum health, there must be a balance between the physical and psychological aspects of life. Further down, it says, in addition to in-office hypnosis treatment, Dr. Anbar, and then he lists out all his staff. That's one of the things I really appreciated. It wasn't, hey, look at me and what I do. You talk about all the other people that work on your staff and list them by name on your website. I love that. Teach patients how to use hypnosis on their own through focusing inwardly and directing their attention toward the positive. Hypnosis techniques can be taught in just minutes to patients as young as 4 years old. So if I'm capturing what I read right, and from our conversations, your hypothesis, which has proven out over years of practice here, is that many times we can manifest, or we do manifest, these ailments and illnesses that we experience through our thoughts. They manifest into a physical form because of the way we're thinking. Many times we don't even know we're thinking that way, but we're causing those problems ourselves. If that is true, then the reverse can be true. We can teach ourselves to think differently and manifest different outcomes and kind of head those things off at the pass. And we're not talking about just things like anxiety for what it's worth, because if we look at Dr. Anbar's abdominal pain, headache, asthma, insomnia, irritable bowel syndrome, I don't know how to say that word. Dyspnea? Is that how do you say that word?
Dyspnea, which is the medical word for shortness of breath.
There you go. Okay. So we're not talking about just feelings. We're talking about actual physical ailments here. And that's why I've been so interested to have you on to kind of talk through all these things, because you've learned and taught so many of these things. I'd love to hear what your approach is. Like, how do you approach these subjects when you first meet with a new client who comes in and says, "Hey, doc," like the old joke, right? "Doc, it hurts when I go like this." "Well, don't go like this anymore. That'll be $20. Thank you very much." Right?
No, it's $200, not 20. We're in the 21st century. To the insurance company, of course.
Yeah, right.
Well, I think that in addition to what you said, I think it's really important to understand that anyone with chronic symptoms, headaches, stomach aches, cancer, diabetes, anyone with chronic symptoms, which is 65% of America, has psychological involvement. So it's not just people who have psychological problems that are manifested as physical symptoms. We have lots of examples of that. But this is where the Western doctors don't get it. So if you've got cancer, your psychology can make the cancer symptoms worse or better. We know people who are optimistic with cancer do better. People who are support groups do better. We know that. It's studied. The beauty with hypnosis is that you can regulate your own psychological reactions. It won't cure cancer, but could give you more life, or it could give you a better quality of life, as an example. Some diseases, it's mostly psychological. So irritable bowel syndrome, that can be almost resolved with hypnosis by learning to calm yourself. And the hypnosis we're talking about for medical illnesses is just general relaxation. Learning how to trigger a relaxation response is sufficient to improve 2/3 of the medical patients. So it takes 1 or 2 lessons. That's it. If you get psychological problems, if the symptoms, let's say you get stomach aches because of bullying in school, or your boss is really bad, those symptoms won't go away so quickly because the bully's still in school and the boss is still bad, even if you don't have a stomach ache anymore. So for that kind of situation, you need to identify the trigger. And too often in medicine, the doctors just treat the symptoms. You have a headache? Well, let me give you a pill. They don't stop and ask, why do you have a headache? And if you want to treat patients well, be it Western or Eastern medicine, you want to look at the patient as a whole, not just as a bunch of symptoms. Unfortunately, we have a medical system in the West that just looks at symptoms. "Hey, doc, I have a pain. Give me a pill." Thank you. Not take the spoon out. The guy who had the pain in his eye every day, he drank coffee. And the doctor says, "Take the spoon out of the cup."
Oh my goodness. Yeah, it's actually another good joke. There's a woman that goes in to see her doctor, and she says, I have this weird situation. I pass gas constantly, but it never smells, and they're silent. And the doctor says, "Here, take these pills and come back in a week." So she takes the pills, goes back and says, "Well, so I'm still passing gas and it's still silent, but the smell is terrible now, doctor. What's going on?" He said, "Well, good. We've fixed your smell, your sense of smell. Now we'll work on your hearing." Take the spoon out. It's another take the spoon out of the coffee joke. That's one of my frustrations with our medical system in the United States, is that it is very symptom focused and not cure focused. Why do you think that is, from your decades of experience in that system?
Well, part of it is the reimbursement system. You get paid for treating symptoms. You don't get paid for preventive medicine. Part of it is Rene Descartes' fault when he separated mind and body.
Mm.
You know why he separated mind and body? Because he went to do autopsies, and the Catholic Church didn't want to let him hurt the soul. He said, no, I'm just touching the body, I'm not touching the soul. That's where we got the mind-body split. So Western medicine thinks the mind and body are separate, so you miss out a lot of the potential answers. Let me tell you a story about my friend, Dr. Mike Weinberger, who unfortunately passed early this year at the age of 87. He was a pediatric pulmonologist like I am, and he treated similar diseases like I did, asthma, and vocal cord dysfunction when the vocal cords close off, and also habit cough. So habit cough is a diagnosis that's been recognized in children for 50 years. Actually, there's reports of habit cough 500 years ago in medical textbooks. What it is a very loud, obnoxious cough that persists throughout the day, stops at night, and there's no medical cause found. So it's been around 500 years. In a modern form, it's been recognized 50, 60 years in kids. And as early as the 1960s, there was an article saying suggestion therapy can cure it. So if you tell a kid, you feel the tickle that causes your cough, now hold off from coughing, take a sip of water, you can hold it longer, and you can talk to a kid, and after half an hour, the cough will stop, or 15 minutes, the cough will stop. And even after it's lasted for years, it'll stop. And again, the hallmarks are it stops when you fall asleep. And by the way, some of your listening audience have habit coughs. If you're hearing this and you have a cough that's obnoxious, no medicine's worked, and it stops at night, habit cough, in my mind, is a likely diagnosis. So in the year 2020 or thereabouts, I was contacted by a father in Maryland whose daughter had habit cough. And he'd read my articles that hypnosis also cures habit cough. I said suggestion therapy. Hypnosis is based on suggestions. So it's the same kind of approach. And I'd written about it. He read my article, and I said, oh, well, I can't practice in Maryland because I'm not licensed there, but I can send you to a hypnotherapist there. But I told him about my friend, Dr. Weinberger, who had since moved from Iowa to San Diego. So we are now neighbors and having lunch every month discussing pulmonary medicine. And the father, Dennis Beutner, contacted Dr. Weinberger. And Dr. Weinberger, who was 83 at the time, couldn't care less about his medical license. That's what I was worried about. If I was practicing out of state, I'd get in trouble. He did suggestion therapy with Bethany, who was Dennis's daughter. And cured, cough got cured. And the dad videotaped this interaction and then posted this video on, he developed a website, www.habitcough.com. You can look it up, habitcough.com. And on the website, he said, if you watch the video and you get better, let Dr. Weinberger know. So the subsequent 2 or 3 years, Dr. Weinberger was contacted by 100 parents telling them that the kids' cough stopped by watching the video, mimicking what's in the video. He was also contacted by 40 adults who said, my cough stopped. My cough had lasted as long as 4 decades and stopped when I watched the video. So we're at our monthly lunch. I said, well, clearly habit cough occurs in adults, but it's not a recognized diagnosis among adults. Adult pulmonologists don't believe it even exists. So the next 3 years, Dr. Weinberger writes article after article, talks to his adult colleagues and saying, hey, adults are cured by suggestion therapy. It seems like at least some of them have habit cough. You have cough clinics, there's chronic cough clinics for adults, where in almost half the patients they can't make a diagnosis nor give them a treatment. Maybe some of them, maybe most of them, but maybe some of them have habit cough. So you know what you could do is have them watch the video, and if the cough stops, awesome. Crickets. I pause on purpose. No adult pulmonologist I'm aware of at this point has taken up this suggestion. Why? Well, this is anecdotal. You haven't done a research study. The habit cough doesn't exist. We're working on pills funded by pharmaceutical companies that are very expensive to stop the cough. And early studies suggested they can reduce the cough frequency by 30%. Okay then. Now, Dr. Weinberger passed away right after a paper that we wrote together was accepted publications. And I was asked to revise the paper. He was the first author. I was just wrote along. I was asked to revise the paper, and of course I did in his memory. And you can look it up. It was published in the Journal of Clinical Medicine. And because I revised, I got to put in a lot of psychology stuff. Dr. Weinberger, I told him about psychology, but he was a pulmonologist. He didn't quite get it either. And I was explaining that habit cough occurs when there's stress, and that I explained how suggestion therapy works. And then to end, I said, so these newfangled drugs for habit cough, they call it chronic unexplained refractory cough. They don't call it habit cough. Adults, it's chronic unexplained refractory. Doesn't respond to medicine cough. I said, so when you do studies, you should compare suggestion therapy with a drug therapy and see if suggestion therapy can eliminate the cough while the drug therapy reduces by 30%. And then decide which therapy is cheaper and has less side effects. I don't think anybody took me up on it. I'm telling this story because I am dismayed at the adult colleagues who won't even, we talked about working within the box. They don't even believe it. And I can understand that. As a physician, people say, well, what about zinc? What about garlic? What about herbs? What do you think about it? I said, I don't know. There haven't been good studies, which is true. I'm not going to start researching it so I get the initial reaction. I can't recommend or not recommend. But in this case, these pulmonologists don't have a treatment for this chronic refractory cough. In kids, this kind of cough goes away with videotapes. There's 40 adults who contacted Dr. Weinberger who said their cough stopped. Oh, it's an anecdote, just by chance. So let them watch a video. There's no harm for watching half-hour video when you've had a 10-year worth of cough that might be cured. So these physicians, in their stubbornness, are mistreating their patients. This is just an example. I can give you other examples of that kind of ignorance. Sad.
Yeah. It is. So I'm a very basic thinker, and I absolutely believe Occam's razor is a great approach, right? Generally, the most obvious explanation is the right explanation for most situations. Not always true, but it usually is. And so I look at the state of insurance in the United States, and I just have some basic questions. Why is it that auto insurance works just fine? Why is it that home insurance works just fine? Why is it that life insurance works just fine? People have no problem finding reasonable coverages that work in their lives for those three versions of insurance. Yet health insurance is extremely complicated. I take that a step further, and from a business perspective, I look at industries that are not heavily regulated like the government, like plumbing. If you have a problem with plumbing at your house, you can literally go on Google and type in plumber La Jolla, and you'll have 15 options to call, and they'll be in your house that day in a lot of instances. Same thing with your car. If something goes wrong with your car, put it into Google, and you get options on where to take your car to get the problem diagnosed. Those are industries that the federal government has never tried to make cheap and affordable for everybody. I look at medicine and say the federal government has tried and failed miserably to make medical care cheap and affordable and accessible to everybody. I think the market is a much better deliverer of goods and services than any government entity would be. My argument is deregulate it as much as possible. I'm not saying Wild West, where we have charlatans selling snake oil to people unregulated. However, we don't need a lot of regulations. I think most people in the medical industry got into it because they want to help people and they want to heal people. And they can't because, like you talked about, they're putting these boxes. And if you want to keep your license, if you want to be able to pay back the hundreds of thousands of dollars of student debt that you took on to become a physician or a surgeon or a nurse or whatever role you serve in that, you're scared to go outside those boxes because it could all be taken away from you. And I just think we're doing a huge disservice to the general population. And we don't teach some base, like, I love that you do psychology, but like, we don't teach nutrition to people. So many, or physiology, kinesiology, right? So many symptoms that people have could be fixed with the proper diet, regular movement, and some positive thinking. Like literally and I'm making numbers up, throwing against the wall. I would bet 3/4 of the ailments people go to see a doctor for could be fixed by some combination of those three things I just listed. But what do I know? I sell groceries for a living.
Well, you're a wise man. I would push back a little bit on homeowners insurance. That's out of control in this country as well,
Yeah.
and also because of regulation. So
I live in
now,
Cleveland, Ohio, so you're right. My experience with homeowners insurance is, I'm sure, is very different than yours living in California.
yeah, so like I couldn't even get home. My insurance has been canceled 4 times over the last 4 years because of the fires that the government has allowed to some degree because they won't want to. You don't want to do controlled burns because it hurts the environment, but then when a wildfire comes, it burns good.
Yep.
And they won't allow them to raise. They're doing the Mamdani plan here in California. They won't allow them to raise insurance prices too high because people won't be able to afford it. So insurers just left the state, and now the state's insuring. I have a state insurance because no insurance. I heard that State Farm might be coming back because they're allowing them to raise rates. I mentioned Mr. Mamdani. Let me just explain a little bit. Mr. Mamdani wants to do rent control, which sounds very nice because rents in New York City are really high, and average Joe can't afford it. And
Sure.
a lot of people who need housing, and so his idea was freeze rent. Problem with that is that a lot of New York apartments are really old. Some of them were occupied by people for 30, 40 years, and they die, and then they had to be renovated to let's come up to modern codes. You can't have your toilet in the kitchen anymore, for example.
Right.
You can't have asbestos in the wall. To renovate a New York City apartment might cost $100,000. Okay, and if they can only charge $2,000 a month of rent because it's rent controlled, they can't afford to do it because they'll never get their money back. So right now in New York City, 26,000 apartments are sitting empty because they can't raise the rent. And Mr. Mamdani, in my opinion, is going to make it worse because he's going to put rent control, so fewer people want to rent out apartments. So that's a problem, an example of, and he wants to help out. I understand that, but some of the solutions are worse than the problem. With health insurance, just I think not only government regulations keeping it low, there should be an insurance. And Trump has talked about this. There should have been insurance, just catastrophic insurance. So if you
That's right.
end up in the hospital and have $100,000 bill, that's paid for, but it's not going to pay for your maintenance care, routine care. And so people say, well, that's not good. People are going to get sick more often. But the truth is, the Obamacare plans that are subsidized by the government oftentimes have a very large deductible. So for those of you who haven't had the misfortune of having to use insurance, if you have a deductible of $5,000 or $7,000, that means that your first $5,000 or $7,000 of whatever healthcare bill you have to pay out of pocket. And if your insurance is subsidized through the Obamacare subsidies that are currently being discussed again, then that means you can't afford the regular rates. Do you think you can afford the deductible? Of course you can. So these people are supposedly insured, but it's not for routine health care. So why don't you just let them buy the catastrophic care, which is a lot cheaper because it doesn't happen very often. And then people are covered and get catastrophic care. Yes, we have a problem. It'd be nice if people got better routine preventive care. I talked about that earlier. But preventive care could be a lot cheaper if done right. And have them watch a video instead of take an expensive drug. That's kind of another very commonsensical thing. But that's not a common thing. That just a video will cure your treatment. But address the psychology before you do a bunch of medical tests. I'm writing an article right now saying that when a medical patient comes in, you should think about the psychology and the symptoms at the same time. Not we'll rule out all the medical problem and then send you to a psychologist. But this should be done concurrently. So for example, I had a child once who came in with a cough. He was sent in because he was sent to the surgeon because somebody thought he had a chest tumor, which he did not. And I took the history, and the story was ever since he was 3 years old, whenever he ate, he coughed. And so I'm thinking, okay, well, maybe he has he's inhaling his food, maybe he has an abnormal connection between his airway and his food pipe. Maybe he has acid reflux. I can think of the medical things. And I could do tests. I could do a pH probe. I put a probe in his food pipe and see if there's acid there that shouldn't be there. I could have him swallow some barium, which is an opaque liquid. You can look on radiology to see if he's inhaling the food. I could do a bronchoscopy, look in his airway, and see if there's an abnormal connection between the airway pipe and the food pipe. And all those tests I just mentioned probably cost $30,000. Okay, but I noticed that he said that he coughs more at school than at home. And I said, if it was physical, why would it be more in one place than the other? So I said, let me teach you hypnosis. Let's do that as a first step. It takes 5 minutes. It's really a long procedure, 5 minutes. And that without side effects. It's not very costly. And I taught him that, and the cough stopped. And in retrospect, I think he had a habit cough. That I think when he was 3, he probably had acid reflux. He coughed after he ate, and then it became a habit. And when I taught him to calm himself, it stopped. So
almost Pavlovian then.
Absolutely. Exactly right. And I stopped. The allergies are also like that. I can get into allergies. Anyway, so I saved a $30,000 workup plus a lot of discomfort by learning how to address the psychology right away. And I want to teach the physicians how to do that and then get past this resistance that, I haven't done that before, so I can't believe it.
Yeah. So let's dive into that a little bit further. I just want to share with you how I kind of stumbled across this mind-body connection pretty early in my life. And mine was through athletics. So from the time I was 3 met my wife when I was 20. If you had asked me what I was going to be when I grew up, I was going to be a professional baseball player. I just knew. I had an affinity for it. I was good at it. And then I worked really hard at it and got really good at it. But as I got older, the physical for a long time, I had physical advantages. I was big, I was strong, I threw the ball harder, I could hit it farther than most people. Well, as you advance through the ranks, everybody has those same skills. So like in high school, I could just throw fastballs by guys because they weren't as good as I was. When I got to college, everybody was as good as I was, and that no longer worked. So you had to learn how to hit your spots. You had to learn how to throw curveballs, all the other stuff that goes with that. But I noticed I have a terrible temper. I know it's hard to tell by looking at me, but I'm super Irish, and I have a terrible temper. I still have a terrible temper. I've just learned how to control it because I'm an adult, and that's part of growing up. But it's still there. And so, like, if someone made an error, I would turn around and scream at him. If an umpire made a call I disagreed with, I'd get in arguments with umpires. That's not really good when you're a pitcher and you're yelling at the guy who's going to decide if the pitch you just threw is a ball or a strike. And so my dad literally grabbed me one day and said, "Hey, do you think you're helping yourself when you do that?" I was about 13 years old. And I was like, I've always been super competitive, but to me, the whole point is to win the game. And I've never lost focus on that. Don't get me wrong. I want to contribute in a big way to winning the game. But if my choice was to go 0 for 4 and be on the team that won, or go 3 for 4 and be on the team that lost, I'd go 0 for 4 every time because I want to win the game. So I said, I got to figure out a way to stop this from happening because I'm not helping my cause here. If I want to win, I should act like I want to win. I should give myself every advantage. So then that inning, I went out to the mound, and before I threw the pitch, I got the ball back from the catcher. Before I threw the first pitch, I took a deep breath in through the nose, out through the mouth. And I threw a really good pitch. And I said, hey, that worked. I'm going to do it again. I had no concept that there's science behind what I was doing, that I was resetting my diaphragm, that I was stimulating my vagus nerve, that I was re-engaging my prefrontal cortex and disengaging my amygdala, all of the things that were happening inside. I just stumbled across it. It was blind luck. I had no idea why it worked, but I knew it did. And then that made me curious. And, not dissimilar. I'm 53, so I grew up in the 70s and 80s, and there was no internet. There was no any of the things you have now. So you had to read. You had to go to places and rent or take out books from the library or buy books or read magazines or those things. So I read a lot, and I read a lot about sports psychology. And there was a lot of talk about the power of positive thinking. So, and it can be little things in sports, like as a pitcher, if you get to a 3-2 count, for those that don't know baseball, the next pitch is either going to be a ball or a strike. So something's going to happen on the next pitch. And if you think to yourself, don't walk this guy, because that's what happens if you throw a fourth ball, or you say to yourself, strike this guy out, you're essentially saying the same thing. One has a very positive connotation, one has a very negative connotation. So I learned, don't let the negative connotations in, only let the positive ones in. And that worked really well for me. But I didn't know, just like you talked about, and where you had this confluence of experiences from earlier in your life, psychology, medical school, research, and it winds up in your practice. I had no concept that these things I was learning would apply greatly in my adult life, in the business world, as a husband, as a father. And you can use those exact same thought process techniques to control your emotions when things are tough at work, when you have a disagreement with your wife, when your kids are getting on your nerves. You can use all of those same concepts to manage how you think. So that's how I stumbled across it. I would love to hear from you. What is your approach when you first engage with a client and you talk to them about using hypnosis to help with their physical symptoms that they're experiencing?
So before I answer the question, I want to just mention that I told you in college I was a biology, psychology major, journalist, and got involved in Judaism, spirituality. Now I combine all those things in my hypnosis. So again, we prepare ourselves without realizing what we're preparing for.
Yes.
So, well, patients right now who come to see me are referred for hypnosis. They're prepared typically for a psychological approach. And in the old days, when they came in with a pulmonary issue, I would tell them, I would say, well, sometimes symptoms are related to how we think about them and how we imagine they're going to be. And if we get anxious about it, makes symptoms worse. So I would like to teach you ways of regulating your emotions. And then we'll see how much better symptoms you get. How much better your symptoms get. I don't say if your symptoms get better. I say, we'll see how much. Because there's a suggestion there.
Yes.
And the Life Guide routines up there, chapter 1 is all about words you can use to help or to hurt. Hopefully it won't do that. How to help people do better. So most people will say, yeah, I'd like to learn how to do that, especially if you could teach it to me right now. If I refer you to a psychologist to learn that, you may not want to go to making an appointment, but it's really easy to teach. First thing I teach is positive talk. I have people stand up and put out their arm like this, and I say, I'm going to push down your arm and do your best to prevent me from pushing down your arm. And if I'm much stronger than them, I'm going to put my hand closer to their shoulder. If I'm much weaker. I've done this with NFL players. With him, I had to go here. And then you want to find a place where you really can't push their arm down. And then you tell them, say I'm weak 3 times. And then they'll be weak. When you push down, even an NFL player, he couldn't hold up. He said he's weak. Then say I'm strong, and then they're strong. And then I say, how does that work? And they'll say, well, what I say is what happens. And then I say, this is important. What do you think will happen if you say I'm not weak? I remember the first time I did this, I was so surprised. When you say I'm not weak, you still get weak. And the reason is the brain focuses on the main word, which is it's like, don't think about pink elephants. You're going to think about pink elephants. So like, don't walk this person. You can think about walk.
That's right.
Then the brain executes. So that's the first lesson. And I talk about the importance of positive talk. I mentioned it's nothing new. Henry Ford, 100 years ago, said, whether you think you can or think you can't, you're right. Right? And the reason is if it's something difficult, you think you can't do it, you just quit. If you can do it, you're going to keep going. And if you keep going, you're going to get it. The Buddha, 2,700 years ago, he said, what we think is what we become. Same principle. So it's been around for many years. I think it's interesting in Judaism, it's not emphasized, I think, because if we say positive, good things will happen, it takes away power from God. Well, I'll point out God created the world with his words. So words are powerful. And I will tell my Jewish friends that God, if you're a religious person, God gave us these powers, these gifts, and you're meant to use them. So that's the first lesson, positive talk. And I go tell people, go and practice, let me know how it works for you. Second session, I'll teach them how to do full hypnosis, which means I usually teach how to relax, although little kids don't like to relax, and then I teach them how to get happy. I'll ask, you like relaxing? Now, because usually the parents will say, relax, go to bed. Now. So the way we do it is I have them imagine a relaxing or happy place, and then they use all their senses, what they can see and hear, smell, feel, and taste. And the reason for all the senses is that you activate different brain parts when you imagine a sense. So it's a whole brain activity. Then I walk them through progressive relaxation. So relax your forehead, your cheeks, muscles around your eyes, your jaw, all the way down to your toes. And as I do that, they become more relaxed. And then an important part is to teach a relaxation sign, so a relaxation trigger. So I'll tell them, pick a sign, cross your fingers, thumbs up, chakra sign, whatever you want to do. And that'll be a relaxation trigger. And you tell yourself, when you're in a relaxed state, whenever I make my sign, I can become this relaxed, even when I'm not doing hypnosis. So that's a post-hypnotic suggestion. And then I tell them to tell themselves good things. And after that, their job is to practice the hypnosis, go in the relaxed place daily, use their sign as often as need to. And again, 2/3 of the medical patients improve a great deal just with these two things I told you about. I mean, talking about 90% improvement of symptoms sometimes just 10 or 20%, but they improve. And it's fast. As long as they want to help themselves, and as long as they believe in what you're telling them. Sometimes I run into people who not going to work, and that's right, doesn't work, because what you say is what happens. But for me, the most exciting part is talking to people's subconscious and talking to them about why they're having the symptoms. That's only really relevant to maybe 1/3 of the medical patients and probably half the people who are coming with anxiety or depression. And you hear amazing stories. And you hear some pretty crazy sounding stories sometimes. And in my books, I haven't told too many of those unusual stories. But in my third book that I just got a contract for, I'm going to tell the stories I've been itching to tell for a long time because they happened and they can be accessible, but they really talk about other realms. People have hard enough time grasping that hypnosis, that the mind-body connection can have such powerful effect on health, mental and physical health. But gosh, there's a bigger spiritual world out there. So let me tell you a short story so you understand what I'm talking about. The farthest left field I went in the first book is a ghost story. This is a story. So a 12-year-old girl comes to see me because she saw a ghost every night telling her to kill herself. And twice she tried to kill herself. And she'd been in psychiatric hospitals and was put on 5 antipsychotic medications, but the ghost still came. And she came to see me, the pulmonologist, who was practicing hypnosis. You can see why the psychologists don't like my stories, because they're saying, why is the pulmonologist talking to us? It's not okay. Well, the reason is nobody else could help. And I'll tell you how I helped. Now, if you want to be a psychoanalyst, you can ask, why was the ghost? What was the ghost representing? I don't take too much time doing that because I want to help the girl figure out what's going on. So I join my patients. I want to speak to the ghost, I said. Well, you can't. She only comes at night, she said. Well, you can invite her. She'll come. Empowering her. The ghost came. I couldn't see the ghost. I talked to the ghost directly. So is it true you want the girl to kill herself? Yes. Why? She's had a horrible childhood, says the ghost, and I wanted to be able to relive it. I can kind of follow that ghostly logic. And I said, well, I'm helping her cope with her horrible childhood. She's already doing better. And when she dies of old age, not if, but when she dies of old age, she can relive her childhood if she wants to. The girl said, okay, that works for me. I'd like to become her guardian angel. I said to the girl, is it okay if the ghost becomes your guardian angel? The girl said, yes, as long as I don't have to see her anymore because she spooks me. And I said to the ghost, is it okay if you're not seen again? The ghost said, yep. I said to the ghost, say goodbye to the ghosts. Goodbye, ghosts. Gone. Never seen again. Half a year later, we got her off of all the antipsychotics, and she was fine. Cool story, right?
Yes. Does she hear from the ghost still?
Nope.
Or not see it? Just not see it?
Doesn't hear, doesn't see. It's gone.
Wow.
So that's in my first book. Here's the part I left out. So after this session, I wasn't quite sure what would happen next. They don't teach you to deal with ghosts in medical school or
Right.
psychology school.
You didn't go that day when they taught the ghost section.
Well, the truth is, unfortunately, modern psychology pathologizes such things. And I say unfortunately because they're not that uncommon. I mean, they're not always destructive, but hallucinations, meaning seeing things that aren't really there, which is pejorative, I think, or in our society is pejorative. A quarter of the kids will endorse them. And I ask them, have you ever seen something that wasn't there? They'll tell me a story. At least the ones who come to see me. So it's not that uncommon, but they're not crazy. So anyway, so with the girl's permission, this is a girl who tried to commit suicide twice.
Right.
I'm not sure what she's going to do now. So with the girl's permission, we told her mother what had happened. And the mother says, oh, what did the ghost look like? And the girl says, well, she's like a 3-year-old girl in a white dress. And the mother said, oh, that's what I've been seeing around the house some mornings. That's one little story of the other world that you can experience through interacting with the subconscious and hypnosis. I've got dozens and dozens, probably hundreds of stories like that I haven't told yet in a book form.
So that, based on what you're talking about, what you're describing, that's much more prevalent, at least from my perspective, it's much more prevalent in our society or in our world than one would expect. Why do you think some people have those experiences and some people don't?
Great question. So I think in Western society, we teach the kids to ignore such phenomena. So when your kid says, I have an imaginary friend, you say, that's nice. That's pretend. That's not real. Or if you're older and you say, oh, I saw something, shh, don't talk about it. I think you're crazy. So I think we teach our kids to shut off that ability to perceive, I think, beyond ourselves. And I think that if you don't shut off that ability, it could cause problems. For example, I saw a 9-year-old who saw this woman in his room that was there but wasn't there. And he freaked out because he knew she became very anxious. She came to see me and I said, oh, you're gifted. Congratulations. You're able to see beyond. And he's been fine. He still has quite a few interesting experiences, but he is gifted. And I have the sense I've sent these kids and young people because I'm seeing a higher and higher concentration of people who come in with this kind of ability. So in other societies like Indian, not American Indian, but Indian, seeing spirits is commonplace. Reincarnation stories are very common. In fact, oftentimes a kid will say, I used to be so-and-so in my previous life, and they find that so-and-so's family and have a big celebration. I've had that experience with my patients that, I used to be so-and-so in a previous life, but I would never think of introducing them to the so-and-so's family. That would be bizarre in Western society, right? And so I interviewed this woman named Sherry Cardenas on my radio show. If anybody's interested in finding this interview, you can find it at www.centerpointhypnosis.com, which is different from the website you said earlier, which is my medical practice.
For what it's worth, Dr. Sherry was a guest on Salty Ginger Talk a couple of months ago. She's a great lady. She's lives now in my hometown of Portland, Oregon. We love Sherry. So, yep.
All right. I don't know if you interviewed her, I think after I interviewed her, I think, if I got the dates right. But I talked to her quite a bit about her life before her brain injury. And she was spiritual, but wasn't really mindful of it. And after the injury, she changed. And her art is amazing. And you can actually find it on the web as well. So I think she's a kind of savant. She didn't think of herself as that, but she is. And I think we all have this ability potentially to communicate beyond. Problem is, if we don't do it a lot when we're young, the brain pruning might make it harder for somebody who's not done it before to start out as an adult. But that being said, most adults who want to talk to like their subconscious can learn to do so. And while you may not develop contact with beyond, you will get a better self-understanding. And I think prayer is a way of also reaching beyond, and another way of helping oneself along these lines.
Yeah, so that makes a ton of sense to me. And I actually have a personal anecdote that supports your theory of the left brain blocking the right brain's ability to see other dimensions and or spiritual things. So, have you ever heard of Dan Ariely? He's a behavioral psychologist at Duke University. Okay, neither here nor there. He studies why people make the decisions that they make, and I found it very interesting. And so I took a class of his online one, just to take it because I wanted to learn. And so during the class, he was talking about people's different abilities people's ability to focus and see things differently. And so I said to my wife, he said, "You're going to take a little quiz, a video quiz. So get ready." I said to my wife, because I'm very left brained, very focused, pretty intense. And my wife is very right brained, very creative, big picture type person. And so the video test is he has 5 people. They're all dressed in black and they're all holding iPads. And on the iPads is a color. One's yellow, one's red, one's blue, one's green. And he says, for 1 minute, you're going to watch these people with the iPads. They're going to move them up and down. And your job is to count how many times you see red appear on any of the screens. And so he says, go. And so I'm like focused. My wife's next to me. We're locked in on the screen. At the end of the minute, I paused the tape and I said, "How many times did you see red?" And she said, 28. And I said, "How many?" She said, "How many times did you see red?" I said, 62. And it was actually 63. So somehow I missed one somewhere. But then he says, "How many of you saw me dancing around behind the people with the iPad in a bumblebee costume?" And I'm like, "What's he talking about?" My wife says, "How did you miss it? I was so distracted watching him, I couldn't watch the iPads." If you had put a gun to my head and said, "Was there a guy in a bumblebee outfit? Yes or no?" you would have had to shoot me because I never once saw him, even though he was in my field of vision. He was on the screen because he played the tape again. And there he was dancing around, sure as hell, right behind everybody. But I was so focused on what I was trying to accomplish, I never saw him, not once. And my wife, because she's big picture thinker, saw him and couldn't focus on what we were told to focus on for the experiment. So that's just an anecdotal experience I have that makes it very easy for me to believe or endorse what you're talking about. I just know the human mind is a very powerful tool, and we can get it to focus on or not focus on things depending on how we train it. And I know that's kind of what you work with your clients on, which is why I find it so interesting.
So if your audience wants to see, there's a YouTube video called The Monkey Business Illusion, same kind of principle. So I won't say more, just look it up, Monkey Business Illusion, and has the same principle as you just described. I think you have to understand that our minds are not geared to see the world as it is. Our mind are geared to make us as functional as possible in the world.
Sure.
So for instance, when you see color, red, green, yellow, there is no color out there. The world has reflected light waves that come at different frequencies as photons. There's no color. The color's in your brain. Unless you're colorblind, in which case there's no color in your brain either. And there's no sound in the world either. There's vibrations. But we hear sounds. And so those are two examples of how our brains are built for us to perceive things that will help us navigate in the world. Not so we see the world as it is, but so we can navigate. So you didn't see the dancing clown because it was irrelevant to your task.
That's right.
And
Yes.
so your subconscious helped you out. And similarly, I think we don't see spirits and ghosts because it would get us confused. There's a story that the Africans back in the slave trade days, when boats came to take slaves to the Americas, Native Africans couldn't see the boats coming towards them because it didn't register as something real. It's really interesting. And so the brain takes shortcuts. Memory isn't real. You might have a clear-cut memory of something that happened. You have no idea if it really happened. One example of that, think of an event, a major event in your life, be it graduation or a birthday party. Think of that event, remember it, and now tell me, do you see yourself in the memory?
No, mine was my high school graduation where I was a speaker and I can see my view from the stage as I was giving my talk. That's what I see.
So that's a closer to real memory than a lot of people will see themselves speaking, and that's obviously a reconstructed memory.
Sure. Yeah.
And then done studies that show that even if you're crystal clear in what you saw, the brain will populate, remember some things, but will populate the rest of the memory with things that are plausible, but unreal. And they've done studies, the day after 9/11, they talked to several graduate students about what happened the day before. So on September 12th, 2001, they interviewed a few people. A year later, they interviewed the same people and said, what happened on 9/11? They had clear-cut memories, but they were not the same as what happened the first day. And when they were shown what they had said the first time, they said, oh, I must have been in shock. They wouldn't believe the memory was incorrect. The author of the book I was reading that talked about it, he himself remembers 9/11 clearly, remembers the three graduate students that were in the lab with him, except one of them was on vacation. But he remembers him there. So memory is inaccurate. People have been convicted to lifetime in prison because of inaccurate memories. There's one famous Boston case where a woman was raped, and as she was being raped, she was intent on finding the criminal, and she looked at his face and she memorized it. And sure enough, she identified him in a police lineup, and then he went to jail based on her testimony, and it was the wrong memory. How did it happen? She was showing him in a lineup. Somehow her mind looked at somebody else, and they reimposed on the memory, and she was absolutely convinced it was correct. So if you're ever on a jury trial and the only witness is an eyewitness, I beg you to let them off because, for circumstantial evidence, fine, but if that's the only thing, that's reasonable doubt in my mind because you don't know if the memory reported is correct or not. And in families, you have people saying, you said this. No, you didn't say that. I tell them, you don't know what happened. You can have a memory of saying something, you might not have said it. And people can see the same event and have different memories, just depending what you focus on, like the clown example.
People lie all the time for various reasons. Sometimes they don't even know they're lying. They're
Correct.
certain that they're correct, but they're just not correct. And, it's one of the things we try to coach people on I try to do that for myself because I'm human. I'm certainly not infallible. And so I have deeply held beliefs that are exactly that. They're beliefs. I don't know if I'm right or not, but I certainly think I am. And one of the things I try to challenge myself to do is to question those beliefs and more specifically, listen to and engage with people that have opposite beliefs or do not share my beliefs so that I can reconsider and try to learn from those things. Like we were talking about Mamdani in New York. And so we have literally centuries of evidence to show that socialism does not work. It has not worked once anywhere. And that's always I just ask anyone who's putting democratic in front of the word socialism doesn't make it any different. You can dress it up all you want. It's still socialism. It does not work as an economic system to provide for the the greater community. It just has never worked anywhere. But I'm always open to more conversation about it because maybe there is someone that's got it figured out. It's failed hundreds of times, and I'm open to more conversation. But I try to make sure that there's evidence supporting my thoughts and beliefs, and a lot of evidence supporting my thoughts and beliefs before I'm willing to put it in the untouchable category. There's very few things in my untouchable category in terms of, hey, maybe you need to think about that again. Maybe you're wrong. Maybe you got that wrong. Maybe you need to
Well,
think about it again.
where socialism worked best in the world history is in Israel, that poor country that's being pilloried by the people who like socialism these days. When they founded Israel, it was a socialist country. The kibbutzim were run on a socialist principle where everybody works together, kids are taken care of together, everybody's fed by the community. And it worked for a few years, but the young didn't want to stay in that system because there's restrictions. They didn't get the benefit of their hard work. But that was close. It started idealism. And so I think it's really interesting. I agree with you. I like talking to people I disagree with politically or viewpoints, and then remain respectful, still love each other, because that's how we should do it. Ruth Bader Ginsburg and Anton Scalia were great friends, even though
Yes.
they disliked themselves. Ronald Reagan and Tip O'Neill, another pair, are great friends. They yell at each other during the day and then have beer at night. I wish our politicians today would go back to that kind of relationship. You respect each other and like each other, even if you don't agree on the solutions. So I think it's very interesting that our society, unfortunately, there are trends against it. Social media, the echo chambers make people so much more certain of their position. But I don't remember who this person was. It was a very smart man who loved to argue, and it's not Charlie Kirk. It's somebody older than that, and he usually was right and convinced people to his point of view. But he was delighted when he was proven wrong. Why? Because you learned something.
Yeah.
And that's the attitude of a very smart person who's confident that when he's proven wrong, they like it. This is an example of if it's difficult, you'll learn. So I encourage your audience members to think in that way and do talk politely to your family members who may disagree with you. Hopefully they stay polite with you. And you can, I've found when I talk, I'm conservative, as you probably can tell, but I've talked to some very left-wing patients, and we can often agree on problems and compromise on solutions. I did write a blog a couple of years ago. I said, "Dear Mr. and Madam President," and I think as president, you should come out there and say we need to compromise with democracy. We need to compromise. And I offered what I thought was fair compromise solutions for all the big problems we're facing. So on immigration, I said, close the borders, but liberalize legal immigration. So we have enough immigrants, but we know who's coming in the country. On gun control, I'm a physician. I want to save life. So don't sell assault weapons. Don't worry so much about any little bit that's going to take away all your weapons. On abortion, find a middle ground, until certain 12, 16, 20 weeks, whatever, the child can be aborted. After that, there should be a lot of restrictions, which a lot of states have now, middle ground. So I wrote this and I gave statistics and suggested the majority of Americans would go for the middle ground. But my friends urged me not to publish this blog. Why? Because I'd be attacked from both ends. And it would take away from my mission, which is to spread the word about hypnosis and emotional regulation as a way of improving mental and physical health. And so I elected not to publish, although if people like me don't publish it, the word never gets out. So maybe this podcast can help towards that.
That's what we're hoping for. And look, that's the whole point. Like you've referenced it a couple times. We haven't talked about it deeply enough, in my opinion, yet. So emotional regulation is the skill that, in my opinion, holds most people back from achieving the life that they want. And so words have power, and the words we use matter. However, I would also argue that if someone can control you or your emotions or your thoughts with just their words, that you are giving up your self power and your self agency very, very easily. And that's not where you want to be as a person. So, an example I use after I was done playing baseball and I was done coaching baseball, I umpired baseball for a while. And so I was a really good umpire for a couple of reasons. One, I'm not real emotional, so I don't get caught up in the antics that are going on. I'm good at making quick decisions, and I've got thick skin, so it doesn't bother me when people disagree. So when there was a close play, like what we call a bang bang play in baseball, where the ball gets there at about the same time the guy slides in, the tag goes down. It's really close one way or another. I'm in good position and I make the call. Let's just say I called the runner safe and the defensive coach comes out to argue with me. The first thing he'll do is come out and say, "You missed that call." And my first response always was, "You could be right. That was really close." And it was so disarming. They didn't know what to say. That you acknowledge, "Hey, I could have. Like, that was really close. I could have got that wrong. I saw him safe." And so I also know what it's like to be a coach and be frustrated in those situations. So I would give them about 30 seconds to vent. And then I would say, "Okay, you've had your say. We have different opinions. Unfortunately for you, mine's the only one that matters right now. The kids are playing a game. We're going to let the kids continue to play the game. It's time for you to go back to the dugout, and we're going to pick the game back up." That almost always worked because I acknowledged their argument that I could have missed the call. That's what most people want when they're upset, is they want to know they're heard. They want to know that someone heard what they said and acknowledges it to them. And that's what I did as an umpire. And they want to get their feelings out, their emotions out, and then they need someone to reset them. So I tried to do all of those things as I umpired. But that emotional control, you'd reference social media. To me, that's one of the things that makes it so hard now for younger people, is they didn't grow up with a lot of the same experiences that like you had or I had, where we were interacting with people. It was almost always face to face. And if it wasn't, then it was certainly over a phone where you could hear inflection and intention and enunciation and things that carry different connotations. Like, you can say the same words, but say them in a different way, and they're going to mean something different. I think it was Don Rickles that gave the example. It says, if I look down in the front row at one of my shows and say, "You son of a bitch," that's going to make someone mad. But if I look down and go, "You son of a bitch," that's going to get a laugh. And it's my job as the comedian to figure out how to manage those things. That's lost now, it seems like, in social media. What's your experience been do you deal with a lot of people who struggle with things that have manifested themselves from experiences on social media? How do you feel about social media?
I wish it could outlaw it, especially for teens. It's caused more damage than helpfulness.
Mm.
I think because people think social media represents the real world,
Oh, yeah.
and it does not. And they spend time on it, which cuts into their sleep. And then they become zombies, and they become tired and depressed and anxious and suicidal and gain weight. All those things are side effects of poor sleep. Our average teenager sleeps, I think, 6 to 7 hours a night, as opposed to the 8 to 9 hours they need. That's 20% less sleep. And it's a massive toll on mental health and physical health in our youth. And unfortunately, our youth don't know a world without social media. This is their norm. And and there's also the video games / that, which is also, the video games are rigged to release your dopamine. So it gives you pleasure, and you spend more time and more money and look at more ads. And they don't care about you as a person. They want to get your time watching the video game. That's all they care about. And that's how they sell ads. And it's damaging so badly in our society. Now AI is going to be another layer of badness, in my opinion, for our youth who are going to use, humans take the easy route when they can. So
That's
it's
right.
easier to have your AI write your essay for you or to solve your math problem. And so the smart kids hopefully will not use AI for that purpose. Although if they're heavily pressured and taking 5 AP classes, they might be tempted. I mean, I used Cliff Notes at my time. Cliff Notes was just a summary of the book as opposed to reading the whole book. Because the teachers, especially AP classes, they don't really think about the impact on the student. These kids are staying up till 1 at night. So if you can use AI to make you take an hour extra sleep, that would be a good thing, you would think. But then the problem is when you use AI to do the thinking for you, you lose the ability to think. My spelling has gotten atrocious since I use spell checker. The word doesn't look right, so I use spell checker. And I can't spell anymore. I used
I
to be a
know.
really good speller. And I thought maybe it's going to get older, but the youngsters tell me the same story. I can't navigate much anymore because the GPS tells me how to go.
So, it's so funny. It just made me think about the aviation industry. And that's one of the big concerns in the aviation industry is the call it 50 years ago, the by far the best path to becoming a commercial pilot was to start off as a military pilot and then move into the private sector after you left the Air Force or the Navy or wherever you were flying for, and keep getting your hours and become a commercial pilot. Now they will train commercial pilots through like special aviation schools associated with each airline, and the challenge becomes the military pilots had so much actual flying experience under duress. So when they had to make quick decisions, when they had to manage their environment, and it literally meant life or death for them in some situations. And so when something went wrong in the cockpit of a commercial airliner, they knew how to stay calm. They knew how to work the situation. They knew how to work the wrecks that are in the plane. They knew just basic, hey, if I need to pick up speed, I need to put the nose down in a dive and pick up speed so I can restart the engines. A lot of that now is lost because people are not literally battle tested like they used to be. And so when something goes wrong, there's a lot of panic and they don't follow the commands that they have in their binder, their operational binders. And a lot of flights now that crash are from pilot error versus any mechanical problem. So it popped into my head when you were talking about like spell check and AI. And yeah, I've been married to my wife for 32 years, and the biggest reason that we've been married to each other and are still happy is because we engage with each other every day. There's no autopilot on our marriage. It's be there, have the conversations, provide the support, do the things that show that they matter to you day after day after day. And that doesn't sound like much, but it compounds over 30 plus years. And a lot of that human element we're allowing as a society to take on less significance. I personally think that's a mistake. I think it's one of the reasons there's so many anxious people, there's so many unhappy people, that people are waiting longer to get married, that people are waiting longer to have children. I'm not an advocate of any of those things. And I'm certainly not saying go back to teenage brides or there's a happy medium in there somewhere, but waiting that long, I don't think is the natural order of things. Just those are my opinions for what it's worth. Be curious to hear your take on it.
No, I think that we've headed into, technology's outpaced our social ability to handle it, and it's getting faster. So, China outlawed social media for kids under 16. We can't do that in democratic society. So China is already aware this is bad. In fact, they gave us TikTok, but in China you can't watch stupid TikTok. You can only watch educational TikTok. So they know better, and they're happy to poison the Western mind, or sell things to the Western mind. Yeah, these are some of the challenges we have. I'm not a Luddite. I think some of these. I just found my book publisher, thanks to AI. I asked AI, what books, what companies publish books about the subconscious, and that's where I found my publisher. I never heard of the publisher before, but there's a lot of small publishers out there that you wouldn't necessarily know about. So AI can be very useful as a search engine, if you like, but it's terrible educationally if you're using it to write for you. I heard that some people find potential date on Tinder and they have the AI write a little introductory message and the receiver writes a little AI response. Is that a new interaction? Is this where we're heading? Sad.
So you know what I use AI for a lot is as devil's advocate. So if I'm, especially for the podcast, so if I'm going to do an episode, like the episode, what was the one we released yesterday? Oh, yesterday we released an episode talking about why uh, following your passion is terrible advice. That developing a skill and falling in love with the process that you use to develop that skill is how you're going to find purpose. And the skill has to have some value in the marketplace. Like it's great that you're passionate, but we can't have a society of pirates and princesses, which is what everybody wants to be when they're 10 years old. That's just not reality. And so I played, I came up with the idea, I developed my script, and then I fed it through AI and said, what are some of the downsides of these arguments that I'm making? What are some of the rebuttals so I can make sure I'm thinking about this correctly and provide good advice or good tips to my audience? And so I'll use it a lot for that. I saw Elon Musk on a podcast, and I'm not a huge Elon Musk. I don't dislike the guy, but I'm not Team Elon or anything like that. But he's clearly a very bright guy. And he's very good at kind of seeing things that are coming down the road. And I'm not. I'm not a visionary. I'm good at execution and I'm good at leadership. But in terms of seeing into the future, I'm not super creative as I sit here right now. And they asked him on this podcast, do you think AI will make people dumber? And he paused for a long time before he answered that question. And he said, I don't think so, but it's a real risk for exactly the reasons you just talked about, because the concern is people stop thinking on their own and doing work on their own to improve their own mental acuity and their own base of knowledge and their own mastery of subjects, rely on this tool to do it. And we kind of have the slow dumbing down of society over generations. I think that's a real risk. I don't know what you think.
And in the book Homo Deux by Harari, this was written in 2016. He suggests that AI or future technology will be able to give you advice about what to do, what choices to make. And of course, you don't have like who should you marry or what job to take. And of course, you don't have to take that advice. But he thinks that at some point in the not too distant future, the AI advice will be more accurate than your own because people make decisions based on their most recent experiences as opposed to taking the whole picture. And if it's found out that AI makes better decisions than we are, then you'd be stupid not to listen to AI. And he worries at some point AI will be that major relying point. Joe, I have a question for you.
Yep.
I have a patient coming in now.
Oh, sure.
So I think we could talk another couple hours, to be honest.
Yeah, we'll schedule something out in January and pick it back up.
And I can, if you remind me, I even wear the same shirt. So it looks the same time.
No, we'll just do it as a separate episode. It doesn't matter. Yeah, look, we have totally got it. I don't want to disenfranchise your business, but I absolutely want to talk to you again. So go take care of your patient. I'll shoot you the scheduling link and we'll get it back another episode going.
And what level did you umpire? What level baseball?
High school.
And what's the highest you got to play?
I played Division I college. It's funny you said the Padres. Back in the 90s, I was talking to the Reds, the Cubs, and the Padres about a free agent deal because I was a right-handed pitcher that threw like in the high 80s, low 90s. There was no reason to waste a draft pick on a guy like me. I was a dime a dozen, but I loved everything about it. But I never signed a minor league contract with anybody. I just played Division I college.
I was just trying to place you if you made it to major leagues. Cool. Well, as I said, I met an NFL player. I met NBA, and I've met MLBs before. So cool.
It's good stuff.
Let's figure out a time. I could talk to you forever. I think we're on the same Maybe it's not as exciting because we agree on most things, but maybe we can find something to disagree on.
Well, we can find something, but I think just getting the subject matter out is what I'm most excited about. So I really appreciate the time. I'll shoot you the scheduling link so we can get another session scheduled. And I really appreciate the time, Doctor. Thank you so much.
I appreciate you. We'll talk. If I don't talk to you before my show, we'll talk again.
Yeah, sounds good.
All right. Take care.
Thanks.
Bye.
Bye-bye. Okay, guys, there you go. So, yeah, look, loved our conversation. We're going to have Dr. Anbar back on. He had to go treat a patient at the end, so we cut our conversation off at 2 hours. However, he was very gracious with his time and said he would be willing to come back and share more with us on another episode. And so we're absolutely going to take him up on that. And so this will not be the last time you see Dr. Anbar on our podcast. Really enjoyed listening to him and learning from him. And we will do that again for sure. So thank you, Dr. Anbar. Until the next time, you keep doing what you're doing. Look, James puts it up right over here every day. Head over to our website, saltygingertalk.com. All of our podcast episodes are available there. Links to all our social media accounts are available there. We publish a newsletter every weekday you can subscribe to there. Make sure you like, share, comment, subscribe to our podcast, whatever platform you consume it on. Really appreciate that. Subscribers are growing like crazy. Views are growing like crazy. Really appreciate the support. We're trying to do a good job of bringing you content that's going to help you build a life of meaning and purpose. Good tips that you can incorporate into your life every day. Great stories from people who have experienced difficult things in life, what they've learned from that, how they've applied that to build the life that they want. All great stuff. We're going to keep finding great people. We're going to keep doing a good job for you guys. Make sure you catch our next episode. We'll see you there.